root. How does that sound? Better? If you answered yes to the previous two questions, then this is the perfect time for you to perform neurosurgery of the flesh on your own brain. You are in the driver's seat now, not your genetics or prior history. Neuroplasticity is your friend and can allow you to recondition your brain to work for you and will enable you to live a happier, more productive life. Neuroplasticity is the change in neural pathways and synapses that occurs due to certain factors like behavior, environment, or neural processes. During such changes, the brain engages in synaptic pruning, deleting the neural connections that are no longer necessary or useful, and strengthening the necessary ones. There is such amazing research now in this subject. The two types of neuroplasticity are functional plasticity, which is the brain's ability to move functions from a damaged area of the brain to another undamaged area. Or second, structural plasticity, which is the brain's ability to actually change its physical structure as a result of learning. More specifically, this relates to how the brain can reorganize and create new neural pathways at any given time in our lives. There is also evidence to suggest that when we learn how to change our own brains, the changes can match those that occur when taking medications. The way it is now, the bulk of the problems occurring with your OCD come from you. The main reason that compulsions seem so hard to stop is because you have rehearsed them so often that they have become very automatic habits that are easy to do without thinking. You get good at things you rehearse a lot. Practice makes perfect. In a study published in Translational Psychiatry, people with OCD underwent daily cognitive behavioral therapy, or CBT, to learn how to better resist compulsive behaviors and to decrease distress. Within 1 month, they had developed extensive increases in the strength of the connections between regions of their brains, which may reflect the participants gained new non-compulsive behaviors and thought patterns. The results bolster the argument for making CBT, cognitive behavioral therapy, more widely available for treating obsessive compulsive disorder, which affects more than 1 in 50 people in the United States. The study also could help guide future treatments that are faster or more effective, which would lower your healthcare costs. Quote, "The changes appear to compensate for, rather than correct, underlying brain dysfunction," by Dr. Jamie Fusner, director of the Adult Obsessive Compulsive Disorder Program at the Simmel Institute for Neuroscience and Human Behavior at UCLA, and the study's senior author. He also quoted, "The findings open the door for future research, new treatment targets, and new approaches." In the new study, UCLA researchers evaluated 43 people with OCD who received intensive CBT, cognitive behavioral therapy, either immediately or after a 4-week wait, and 24 people without OCD who were used as a comparison group. Now, all of the participants underwent scans with a neuroimaging tool called functional magnetic resonance imaging, or fMRI. Those with OCD were scanned before and after 4 weeks of treatment, and those who did not have OCD and therefore did not receive treatment were also scanned before and after the 4 weeks. When the scientists compared the before and after brain scans of the participants who received cognitive behavioral therapy, CBT, they saw an increase in connectivity, which signify greater communication in the brain between the cerebellum and the striatum, and between the cerebellum and the prefrontal cortex. The scans of people without OCD did not show any changes. And among the people with OCD who waited 4 weeks for their treatment, There were also no changes during the waiting period, demonstrating that the changes in the brain do not occur spontaneously with the passage of time. Quote, the results could give hope and encouragement to OCD patients, showing them that cognitive behavioral therapy, CBT, results in measurable changes in the brain that correlate with reduced symptoms, said Tina Moody, a UCLA research associate and the study's first author. Over the years and decades that you have suffered from OCD, anxiety, and depression, you have been actively retuning your neural architecture of your brain. In the past, passion has prevailed over reason, favoring short-term self-interest, compulsions, over the longer-term advantages of prudent self-constraint, response prevention. Change that last.